Well, a common ingredient in many of the most popular over-the-counter cold and flu remedies may be removed if the FDA accepts the recommendation of its advisory panel.
The drug is marketed as a decongestant, but there is mounting evidence tonight that it may be ineffective. Dr. Frank McGeorge is here to explain exactly how wide-ranging the effect could be and also some available alternatives.
Yeah, and there are alternatives, Karen and Damon. So the drug is called phenylephrine, and it works to relieve nasal congestion by decreasing the blood flow to the lining of the nose. Now, it's allowed to be part of the over-the-counter preparations because the FDA declared it to be generally recognized as safe and effective. That was decades ago. Now, that specific terminology is actually important because there's been growing research that it is not effective at reducing nasal swelling when it's taken by mouth.
The growth of over-the-counter products containing phenylephrine, often designated by a PE in the product name, is a direct offshoot of a regulatory change that affected a different drug, pseudoephedrine, known to most as Sudafed. Back in 2006, cold medications containing pseudoephedrine were moved behind pharmacy counters because the drug could be processed into methamphetamine. But pseudoephedrine is also an effective and widely used decongestant. Forced to find a substitute that didn't require going to the pharmacy counter, drug companies started marketing medications containing phenylephrine instead. Well, now, an independent advisory committee told the FDA phenylephrine is ineffective as a decongestant, and it advised the FDA the drugs shouldn't be sold. The agency said it will study the recommendation.
Now, this is an enormous shift. It's estimated actually $1.8 billion worth of over-the-counter cold remedies containing phenylephrine are sold every single year. Now, I should point out that even though the brief to the FDA indicated that the research found oral phenylephrine was ineffective, it did actually recognize that some consumers believe oral phenylephrine is helpful to them and that its removal may actually end up causing anger and frustration among those people.
Okay, so then if you remove it from over-the-counter products, then what are you supposed to do if you're all stuffed up?
Well, that's an important point, and there are actually, fortunately, some alternatives. So, for relief of congestion, regardless of the cause, pseudoephedrine, which may be labeled PSE, that is very effective, but it's going to require that you go to the pharmacy counter and sign for it. It's inconvenient, but pseudoephedrine, Sudafed, does work. Now, I would also say nasal sprays like Afrin or Neosynephrine are also a reasonable option, but only for very short-term use. If you use them for more than a couple days, there's actually a risk of worsening nasal congestion, that rebound rhinitis medicamentosa. Now, if your congestion is specifically from allergies, though, I would actually suggest using antihistamines or nasal steroid sprays instead to reduce the risk of congestion even occurring.
So you have options, but if you're turning to the spray, don't overdo it.
That's, I think, the main thing, yes.
All right. Thanks,
Doc.
Doc.